Trowers, and today we'll be injecting one of my patients with some of the most commonly used fillers, Restylane Silk as well as Perlane. So her areas of concern are actually in the nasolabial folds, which is also called the marionette lines or the smile lines, and you can see that she has a little bit of this ridge here as well as over here. And part of that just results from normal facial movements as well as from loss of volume over time. Everybody loses some volume in their face, and what happens is the cheek kind of shifts down, and that's what gives you that fold. So besides addressing the fold itself, we'll also be putting a little bit of volume here to lift up her cheek, because you can see that that automatically softens the line, and we'll put a little bit in the corners of her mouth here. As my one patient says, it looks like almost sad emoji, and we want to make her into happy emoji. So we're going to go ahead and get started. Okay, so we're going to go ahead and get started. We already had some numbing cream applied to her so that the area is partially anesthetized. And I'm going to start by concentrating on this little etched in line right here by the corners of her mouth. So we just stretch out the skin so we can get it at the right angle. But you see how right away it's starting to smooth out where that fold is. This is one of my favorite fillers for these little fine details because it actually helps to smooth the skin. Let me have you open your mouth for a second. I'm just going to massage here. Good, and then close. Good, and then open. So you can already see how we filled in this line significantly and softened it. She's just a little bit red and swollen. And you can see also how we picked up the corners of her mouth. Whereas if you tilt your chin down a little bit, good. You see how she has that little bit of a fold here, but we filled her in right here. So now what we're doing, I already put a little bit in. We're going to just lift up and kind of round her cheek a little bit because, you know, she's in good shape. And everybody loses a little bit of volume here over time, which contributes to this. So I'm just going to put a little here just to lift her up. So it's the Restylane Silk that we used over here, and over here we're just using a little bit of the Perlane. So you can see here when you look at her cheek how it's just a little softer now from that contour rather than that sharp angle there. And she'll get a little bit of a pinpoint bruise in that area, but we'll just press it out. Good, perfect. So we already finished injecting the right side of her face, so we're going to have you take a look so you can see the comparison of one side to the other. So I filled in the marionette lines right here, and we also put a little bit of volume into her cheek. So when you compare one side versus the other, you can see this side where we filled in the corners of her mouth. We also gave a little bit of volume back to her cheek. Where you see on this side, which we haven't injected yet, you see how the cheek falls down, and you can see where this line is engraved and the corners of the mouth go down a little bit. So we're going to go ahead and inject the other side now. I also wanted to show before I start doing the left-hand side the difference when she's smiling. So if you look at her when she's not smiling, you see how we really softened these lines. We filled in the corners of her cheek right there. And then if you smile for me, you see the difference here. You see how she doesn't have this line here anymore. You see her cheek has that nice full arc where she's a little bit flat on this side. Okay, we'll go ahead and get started. Okay, so we're all done now with doing her injections. We've completed both the right and the left side of her face. She's just a little bit red, a little bit swollen, but you can see we've significantly softened those lines. We turned her sad emoji into a happy emoji, and we put a little bit of volume into her cheeks. So when we see her at our follow-up in 2 weeks, we'll make sure that we have her before picture so that we can hold them up side by side so you have a comparison. So we'll see you then. So we're now at the follow-up appointment for my patient who we recently injected with Restylane Silk into the nasolabial folds. So we're going to be taking a look at her now. So when you look at this area here, you can see that the lines are way softer. And if we compare that to her before picture, you can see that before these lines were really carved into her skin. But by utilizing the Restylane Silk, which is a hyaluronic acid, which is a substance that your body naturally produces, but it's a man-made version of it, we were able to significantly soften those lines. So she got great results, and I'm really happy with how it all turned out. So if you have any questions, please give us a call at the office for our cosmetic consult. Thank you.